Asthma is an inflammatory and obstructive lung disease that basically makes it difficult to breathe. A lot of patients with asthma will cough or wheeze, and sometimes they describe that they feel like they're breathing through a straw. Patients with asthma have baseline inflammation in their lungs. This inflammation causes obstruction of air. That is to say, it's difficult for them to fully exhale when they're breathing. And because of this, they have a feeling of shortness of breath. Sometimes they will wheeze or cough, and a lot of times they feel chest tightness. Asthma symptoms can happen during the daytime. They also can happen at night, and some patients will wake up in the middle of the night coughing, or they wake up in the middle of the night gasping for air. Asthma impacts people of all ages. It can start as early as a patient who's a toddler or even an infant. It frequently affects school-age children and teenagers, but asthma also definitely affects adults. Many young adults as well as elders will have asthma. There are many common asthma triggers. Some of them are allergic triggers, especially for people who have allergies, like for example, exposure to grass pollens, tree pollens, weed pollens, or cats and dogs. There are also non-allergic triggers for asthma. For example, weather changes, exposure to smoke, viral illness, or exercise and physical activity. There are several treatments for asthma. The most common asthma treatment is use of a daily inhaler medication. The most common daily inhaler medications have medicine that reduces the inflammation in your lungs and also opens up your lungs. And this directly alleviates the symptoms of asthma, so it improves your cough, shortness of breath, wheezing, and that feeling of chest tightness. Another treatment for asthma is called allergen immunotherapy. For people who have allergies and asthma, exposure to the things they're allergic to will often make their asthma worse. Allergen immunotherapy is a treatment that retrains the immune system to ignore what you are allergic to, and in doing so can improve asthma, particularly the asthma that's driven by exposure to what someone's allergic to. For patients with asthma, it's really important that they adhere to their prescribed treatment plan. There are several reasons for this. One of the most important reasons is that daily adherence to their medications will help improve their day-to-day symptoms. This will help them not feel like they are short of breath. It will reduce their cough. It will reduce wheezing and chest tightness. It will help them sleep better at night. Another reason that it's important to adhere to the treatment plan is to maintain long-term lung function. It's really important for patients with asthma to adhere to their daily medication plan in order to slow down that decline in lung function. And this is critical so that they can maintain the best possible long-term lung function to help them feel better and breathe better as long as possible. At KCAA, we are allergy and asthma experts. If a patient is concerned that they may have asthma, we first start by doing a complete history. We also do a thorough physical exam, and we have breathing tests that we can do to get baseline lung function and to see if someone might have asthma. Once we gather all the important data, we will formulate a treatment plan with close follow-up in order to optimally manage asthma and make sure that symptoms are improving. Patients with asthma who adhere to their prescribed treatment plan can have a significant improvement in quality of life. For example, I had a patient I saw last week who told me that she would like to walk every morning with one of her friends, but she had to initially reduce the amount of time she walked and then eventually just stop walking altogether because she just couldn't breathe during her walks. After we evaluated her and came up with a treatment plan, she returned and said that she's now back to the full length of walks and she's really enjoying being outdoors again. She's very happy and she's exercising again. She's feeling good, she's breathing better, and managing her asthma was a big part of that improvement. Asthma is actually one of my favorite conditions to treat. When I see patients with asthma, they have a very real impairment in their quality of life. They're suffering. They're having trouble breathing. They're having trouble sleeping at night. They're unable to do the activities in their daily lives that they really enjoy. But once I evaluate them and come up with a treatment plan, they are very responsive to that. Their quality of life has a significant improvement, and it's really satisfying to just see how they are much happier and living their lives once again.